Hey there! Welcome back to Banana Life. Today we're talking about something really important, something that could affect you, your family, or someone you know. We're diving into the recent measles outbreak and what you can do to protect yourself and others. So, what exactly is measles? Measles is a highly contagious disease caused by a virus. It spreads through the air when an infected person coughs, sneezes, or even talks. You can catch it just by being in the same room with someone who has it, even hours after they've left. That's how easily it spreads. The first signs of measles often feel like a regular cold. You might get a fever, a cough, a runny nose, and red, watery eyes. But a few days later, a red rash starts to appear, usually on the face first, then spreading down the body. The rash looks like flat red spots, sometimes with small raised bumps. It usually lasts about a week, but the illness can be much more serious than it seems. Why is everyone so worried about this outbreak? Because measles isn't just an annoying rash and a fever, it could be dangerous. It can cause complications like ear infections, diarrhea, and pneumonia. In some cases, it can lead to brain swelling or even death. Babies, young children, pregnant people, and those with weak immune systems are at the highest risk. So, why are we seeing outbreaks now? A big reason is lower vaccination rates. The measles vaccine, known as the MMR vaccine because it protects against measles, mumps, and rubella, is incredibly effective. Just 2 doses can provide about 97% protection against measles. But if not enough people get vaccinated, the virus can spread quickly. Some people can't get vaccinated, like infants who are too young or people with certain medical conditions. That's why it's so important for everyone else who can get the vaccine to do so. It protects the whole community. This is called herd immunity. Let's talk symptoms. If someone gets measles, it usually takes about 10 to 14 days after exposure for symptoms to show up. First comes a high fever, sometimes as high as 104 degrees Fahrenheit or 40 degrees Celsius. Then you might see a cough, runny nose, and red eyes. A few days later, those small white spots called Koplik spots can show up inside the mouth. And finally, the rash appears. It usually starts on the face and spreads downward. The rash and fever can last up to a week. If you or someone you know has these symptoms, don't wait. Call a doctor right away. Let them know you might have measles before you go in so they can take steps to protect other patients. Now let's talk prevention. What can you do to stay safe? Number 1, get vaccinated. The MMR vaccine is safe, effective, and widely available. If you're not sure if you've had it, check with your doctor. Many people got vaccinated as kids, but some may have missed a dose or need a booster. Number 2, stay informed. Measles outbreaks often happen in specific areas or communities. If you're traveling or if there's a local outbreak, take extra precautions. Number 3, know the symptoms and act quickly. If you or someone in your household shows signs of measles, especially if you've been near someone with the disease or traveled recently, isolate yourself and contact your healthcare provider. You might be wondering, what about kids? Vaccination is key for children. The first dose of MMR is usually given at 12 to 15 months of age, and the second dose between 4 and 6 years old. If you're planning to travel internationally with young kids, the CDC recommends an early dose for babies as young as 6 months. Talk to your pediatrician about what's best. Let's take a second to talk about myths. Some people worry that vaccines cause autism or other long-term problems. This idea has been thoroughly studied and proven false. The original study that sparked those fears was retracted, and the doctor who published it lost his medical license. Decades of research show the MMR vaccine is safe and does not cause autism. Another myth is that natural immunity is better than vaccine protection. While it's true that getting sick with measles can give you immunity, it's not worth the risk. Measles can lead to hospitalization, long-term health problems, and even death. The vaccine gives you strong protection without the danger. Now, let's say you've been exposed to measles. What should you do? If you've had both doses of the vaccine, chances are you'll be fine. But if you're unsure or unvaccinated, you need to act fast. Contact your doctor immediately. In some cases, a dose of the MMR vaccine within 72 hours of exposure can help prevent the disease. Immune globulin treatments may also help if given within 6 days, especially for people at high risk. If you do get measles, the best thing you can do is rest, drink fluids, and stay isolated from others, especially young children and people with weak immune systems. There's no specific treatment to cure measles, but supportive care can help manage the symptoms. Let's recap the key points. Measles is highly contagious and spreads through the air. Symptoms include fever, cough, runny nose, red eyes, and a spreading rash. Serious complications can happen, especially in vulnerable groups. The MMR vaccine is safe and effective at preventing measles. Check your vaccination status, especially before traveling. Contact a doctor immediately if you think you've been exposed. Isolate if you're sick and protect those around you. Measles isn't something we can ignore. Even one case can quickly become an outbreak if people aren't protected. But the good news is we know how to stop it through awareness, vaccines, and quick action. By understanding the risks and taking simple steps, we can keep ourselves, our families, and our communities safe. You don't need to panic, but you do need to be prepared. Thank you for tuning into Banana Life. We hope this video has helped you understand more about the measles outbreak and how to stay safe. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health and wellness tips. Share this video with anyone who might need to hear this information. Until next time, take care and stay healthy.